Hello and welcome back. This is our lecture on abnormal labor, and in this part, we are mainly focusing on how to plot a partogram and how to interpret it. So, basically, partogram is the graphical representation, right? How slow or how quick is the labor progressing, or is it normal, and how do we know that? Say, for example, this is just the cervicogram part of the partogram, which is actually the most important part, which tells us how the progress of labor is going. So on this cervicogram, there are two parts. First is cervical dilatation, and second is the descent. We are mainly going to discuss about the cervical dilatation because that's the most important. So, say for example, if we have a patient at 6 o'clock in the morning, she is 6 centimeters dilated. We always start partogram in the active phase of the first stage of labor. Now remember, there are two lines. One is alert line, second is action line. And this alert line, it starts from 4 centimeter, even the action line, it starts from 4 centimeter, and they go till 10 centimeter dilatation. And how is this diagonal line set? It is based on like 1 centimeter dilated per hour. How do we know per hour? So this is 6 o'clock. For example, this one from here to here, it is one hour. Okay. Say for example, this woman was 6 centimeter, 4 centimeter dilated at exact 6 o'clock in the morning. Then if everything is fine, there is no concern about baby's heartbeat or anything, I will examine her after 4 hours, right? Uterine contractions are normal. Apparently, it's going normal. So after 4 hours, I noted that, oh, actually, she has dilated only 2 centimeter. Remember, in 4 hours, 2 centimeter is the minimum. Okay. Ideally, it should be more than that, right? So 2 centimeter is the minimum. Okay. Right. So ideally, it should be at least 1 centimeter per hour. Okay. So 2 centimeter per 4 hour, that's a minimum. So she has dilated the minimum. I mean, she's still normal, right? It's still within the normal range, but I need to keep an eye on her. How do I know? This was the alert line, right? This is the action line. Action line means deliver the patient, which is usually by C-section. Alert line means re-evaluate the situation. It is just a flag, a red flag, or a heads up that this patient may end up having crossing this action line, having a C-section. Okay. So now, see, if it is above this alert line, like if this yellow point was somewhere here, it would have been great, right? If she has now, this has crossed the alert line, that means I need to reassess the patient. How will we reassess? I have to keep in mind the three P's. What were the three P's? First is power. So I will recheck, is she having enough contractions? If not, and if there are no contraindications, I may start augmentation by oxytocin. Okay, that's one P. What was the second P? I will reevaluate what is the fetal presentation or position. Am I missing something? Is it brow presentation? Is it face presentation? Is it direct occipito-posterior? I just need to reevaluate the situation because I just want to make sure that I'm not missing anything. Or is it a macrosomic baby? Just reassess. Okay. Do a vaginal examination. On vaginal examination, we have to make sure when we are assessing the dilatation, we have to also check the position of the baby. Okay. When we are reassessing, we have to repeat an abdominal examination just to make sure that everything is fine. Okay. And to make sure that it's not going into obstruction. Okay. So this is just a heads up. Okay. This is just reevaluate. And then because we are concerned here, right? It has crossed the alert line. So what will I do? I won't wait for 4 hours. Instead, I will do a vaginal examination after 2 hours. So at 10 o'clock, I did this. So it was still not perfectly normal. It was not green. They don't use these green, yellow, amber, or red. This is just for understanding. I have done it. Okay. It will be just a cross here. And then at 12 o'clock, if I examined her, for example, she's still 6 centimeter. Oh, in the last 2 hours, she hasn't progressed. Remember, she is on action line now. She has not crossed it. So what will I do? The next vaginal examination I should do after 1 hour. As a student, you do not need to remember when you should do a vaginal examination. Okay, that's okay. But what I want you to remember is, what do we mean if it crosses action line, and what it means if it crosses the alert line. That's all you need to remember. And that partogram is started after 4 centimeter. Okay, not in the active phase, however you define it. Some people define it after 6 or 5, whatsoever. Okay, but it is started in the active phase of the first stage of labor. So this is it, right? And then let's take another example. For example, this patient, imagine it was again 6 o'clock here, this is 7 o'clock, this is 8 o'clock, this is 9 o'clock, or whatever time. Say, for example, 6 o'clock, she is 4 centimeters dilated. Or it can be, we can even start by 5 centimeter, right? It should be more than like what we define active phase. So I had some concerns. Maybe I when I monitored her uterine contractions, it was less, very like 1 to 2 contractions, or even 3 mild contractions. So I'm not happy with the contractions. So what I did, I repeated a vaginal examination after 2 hours. Okay. And then I noted that, okay, she's progressing well, right? She has not crossed the alert line. Just compare with the last one where she had crossed the alert line. So here she has not crossed the alert line. So what will I do here is I will just continue, right? I will examine her after 4 hours. And then what will happen? Once I examine her at 4 hours, because everything was fine, right? So maybe I started, yeah, so we just continued. And when I examined her after 4 hours, I noted that, oh, in the last 4 hours, she has dilated only 1 centimeter. So she has now crossed the alert line. Then what will I do? I won't wait, right, for 4 hours for next vaginal examination. I will perform a vaginal examination after 2 hours. Now she, say for example, she's still 8 centimeter. Now this is getting serious. Just look at the plot, right? This is not normal. This is a prolonged labor. So what will I do? I want the next one. I don't won't even wait for 2 hours, right? Maybe I will start oxytocin, whatever is the problem. Say, for example, it was less uterine contractions. I will just start oxytocin and examine her after 1 hour. So now notice it has crossed the action line. That means now I have to perform a C-section. Okay, so partogram basically detects abnormal labor timely. It prevents unnecessary C-sections. Okay, because I should not perform a C-section here. Now I have justification here until and unless baby's heartbeat is normal.